Hi everyone, I am Mr. Riyaz Ahmed, Assistant Professor, Department of Pharmacology, Yenepoya Pharmacy College and Research Center. Welcome to the video. The topic Histamine and Antihistamines. So, contents of today's topics are autocoids, histamine, sites and synthesis and storage, types of receptors, pathophysiological roles, histamine analogues, pharmacological action of histamine, antihistamines, mechanism of action and pharmacological actions and classification and therapeutic uses. At the end of this session, the student should be able to understand what is autocoids, types, histamine, explain different types of receptors, explain antihistamines and classification, pharmacological actions of antihistamines, therapeutic uses of antihistamines. So let us start with autocoids. So autocoid is derived from a Greek word, that's auto, eikos. Auto means self, eikos means healing or remedy. So autocoids are the chemical substances produced by the body as a part of immune response. So these are diverse substances produced by a wide variety of cells in the body, having intense biological activity but generally act locally. So it is synthesized, distributed, and it shows its effect and it's destroyed at the site of release. So it is called local hormones. So it is based on its chemical nature, it is classified as amine derived autocoids, in that histamine, which is amino acid histidine, then serotonin, which is also called 5-HT, 5-hydroxytryptamine, peptide derived autocoids, angiotensin, bradykinin. Then third one is lipid derived autocoids, which is prostaglandins, interleukins, platelets, activating factors. So what are the functions of autocoids? The first one is it has a physiological function of autocoids, which is like on smooth muscle contraction, relaxation, secretion of gastric acid, blood pressure regulation, etc. Then there are pathophysiological functions of autocoids, reactions to injury, mediators of inflammation, and first part of immune response, and transmission and modulation, regulating secretions, impacting nerve transmission, local hormone transmitting signals within nervous system. So first we'll see amine autocoids. It is derived from natural amino acids. So histamine and serotonin are the major autocoids in this class. Today we are going to discuss only histamine. So chemically, histamines are called imidazole ethylamine, formed from the amino acid histidine. Important inflammatory mediators as in the immune response. It has a potent biogenic amine and plays an important role in inflammation, anaphylaxis, allergies, gastric acid secretion, and drug reactions. As a part of immune response to foreign pathogens, histamine is produced by basophils and mast cells found in nearby connective tissues. So there are different sites where histamine is released. First one is mast cell sites, in that mainly pulmonary tissues, mucosa of bronchial tree, and on skin, then GIT, that's intestinal mucosa. Then concentration of histamine is particularly high in these tissues. Then there are non-mast cell sites like CNS on the neurons, epidermis of the skin, GIT, gastric cells, cells in regenerative rapidly growing tissues, and in the basophils, which is in the blood. Synthesis, this histamine is synthesized from decarboxylation of amino acid histidine, which is stored in mast cells. Histamine positively charged is held by an acidic protein and heparin, which is negatively charged, within intracellular granules. So the histamine is stored as a histidine in the granules. So on degradation, it undergoes oxidation and methylation, thereby it becomes inactive. So here you can see the histidine, which is inactive compound. When it undergoes decarboxylation in the presence of decarboxylase enzyme, it forms histamine. Then there's two enzymes, one is N-methyl transferase diamine oxidase. Oxidation and methylation happens, thereby it becomes imidazole acetic acid, there it degrades. So mechanism of release. There are different mechanisms where this histamine is released. Histamine held by an acidic protein and heparin within intracellular granules. Granules extrude by exocytosis. The sodium ion gets exchanged for histamine. So there are two different types of the mechanism of release. One is Ig mediated, immunoglobulin mediated, which is antigen induced release. Upon first exposure, the Ig antibodies bind to mast cells and sensitize them. So Ig antibodies, which has a receptor, on re-exposure to the allergen, when allergen come and sit on the receptor site of Ig, the allergen binds to Ig on the mast cell surface, triggering degranulation and releasing histamine along with other mediators like prostaglandins or leukotrienes. Then the non-antigen mediated release, like some drugs which is chemical mediated or physical mediated, some drugs like morphine, codeine or venoms or physical factors, heat or trauma, can cause non-exocytic release by distribution of disturbance of mast cell membrane or displacing histamine from the granules. The chemical and mechanical mast cell injury causes degranulation of cytoplasmic granules and histamine is released. Certain amines accumulate in mast cell due to affinity for heparin, displace histamine, which form heparin liberator complex, which increases the permeability of mast cell membrane and diffuse histamine. So here you can see mechanism of antigen antibody reactions. So this is a mast cell where histamine is stored in the granules, where antigen, when it come and sensitize Ig, the Ig activates the mast cells to degranulation. So there, when there is a degranulation happens, so the histamine is released into the sites. So there are different types of receptors. This histamine produces its action by activating its receptors. So there are four subtypes of histamine receptors are there. One is H1, H2 receptors, H3 receptors and H4 receptors. So first let's see H1 receptors. Here the mechanism is like histamine binds to H1 receptors, activates GQ proteins, which is protein coupled receptors, triggering the phospholipase C pathway formation of IP3 and DAG, increasing intracellular calcium. This calcium is replaced by the histamines. So the location of H1 receptors is mainly present in smooth muscles, which is on GIT, airway and uterus, then on blood vessels, then bronchioles, then brain. So on smooth muscle, when this H1 receptor activates, there will be contraction of GIT, airway or uterus. On blood vessels, there will be vasodilation. Then on bronchial muscle, there will be bronchoconstriction can happen. In brain, it acts as a neurotransmission, adrenal medulla, which increases the release of catecholamine, which causes severe itching or pain. So agonists, 2-methylhistamine, 2-pyridyl ethylamine. Agonists are like which increases its action. Antagonists are which suppress its action, which is example chlorpheniramine malate. So second one is H2 receptor. Here the mechanism of activation is like histamine activates GS protein at H2 receptors, which stimulate adenyl cyclase to increase cyclic AMP level. So the location of these H2 receptors are on stomach, blood vessels, heart and brain. So in stomach it increases acid secretion. On blood vessels there will be vasodilation. On heart there will be tachycardia, which is increased heart rate and increased contractility. On brain it acts on neurotransmission and it acts as a neurotransmission activity. Then agonists are N-methylhistamine, dipaprate, and antagonists are cimetidine, ranitidine, famotidine, etc. The third one is H3 receptor. Here the H3 receptors are mainly found on nerve endings. When activated, they couple with GI proteins to inhibit adenyl cyclase, thereby decreasing cyclic AMP. This reduces the release of neurotransmitters like histamine, acetylcholine and norepinephrine, acting as a feedback control in the CNS, central nervous system. The location of H3 receptors mainly on brain presynaptic nerve endings, on ileum and in blood vessels. In brain there will be decreased neurotransmitter release which causes sedation. Then on ileum, which decreases acetylcholine release. Blood vessel also there will be decreased norepinephrine release and there will be vasodilation. So agonists are imitite, antagonists which suppress its action, thiopyramide. Then there is a H4 receptors. In H4 receptor is same as H3, which is similar its actions. Receptor also couple with GI proteins and reduce cyclic AMP level held in chemotaxis, which is movement of eosinophils and mast cells, contributing to allergic and inflammatory responses. So location are bone marrow, it will be on the bone marrow, eosinophils, mast cells and basophils. So functions are mast cell chemotaxis. Chemotaxis how immune cell smell chemical signals and move towards the site of infection, injury or inflammation. So let's see the pathophysiological roles of histamines. So it can cause ulcers. Excessive stimulation of H2 receptor, which is there in the GIT. So when it is stimulated, it produces excess acid secretions, which can cause ulcers, different types of ulcers. Then allergic phenomenon, mediation of hypersensitivity reaction has been the first role ascribed to histamine. Causes of inflammations like chemotaxis, opsonization, which is coating of microbes by immune cells to enhance phagocytosis, which can increase the inflammation, which can cause itching and pain. As a transmitter, it initiates the sensation of itch and pain at sensory nerve endings. So due to sudden vasodilation, it can produce severe headache. So uses, as such, the histamine has no therapeutic value, but occasionally it is used in some diagnostic tests like testing gastric acid secretion, diagnosis of phenchromocytoma, pulmonary function, to test for bronchial hyperactivity. So there are substitute for histamine, which is called histamine analogs, which has got therapeutic uses like beta histine, which is H1 agonist, which increases the action of H1 receptors. So used to control vertigo in patients of Meniere's disease. Vertigo means is a type of dizziness characterized by the illusion of rotational movement caused by disturbances in the vestibular system. So treatment of vertigo, the beta histine is used. It also acts by causing vasodilation in internal ear. So another one is betazole, which is H2 agonist used in gastric secretion tests. So the pharmacological actions of these analogs are on blood vessels. It causes marked dilation of smaller blood vessels. Dilation of cranial vessels causes pulsative headache. There will be throbbing headache, like it will be like a rhythmic headache. Then causes increased capillary permeability due to separation of endothelial cells. There will be exudation of plasma. So intradermal injection, when this analogs which is given intradermally, it can cause triple response, which is flush, flare and wheal. Flush means red spot due to intense capillary dilation, immediate reddening at the injection site. Wheal due to exudation of fluid from capillaries and venules. Local swelling, there will be a swelling at the site of injection. Then flare, redness in the surrounding area due to arterial dilation mediated by axon reflex. So on glands, H2 receptors on parietal cells, which is there in the GIT, causes marked increase in gastric secretion, primarily of acid but also of pepsin, which increases cyclic AMP generation, which in turn activates the membrane proton pump, thereby increases the chance of ulcer. Then sensory nerve endings injection, IV or intracutaneous, it can cause severe itching. On CNS, the histamine or histamine analogs, it does not penetrate blood-brain barrier, thereby there will be no CNS actions. But when it's given intracerebroventricular administration, the H1 and H2 receptor get activated. It produces rise in blood pressure, cardiac stimulation, behavioral arousal, hypothermia and vomiting, and ADH hormone release. So let's see antihistamines. Antihistamines are the agents which are used to block the action of histamines. So let's see antihistamines. So here it mainly blocks the general mechanism of action of antihistamines are, it mainly blocks by three different ways. Like one is blocks action of histamine at receptor level. There are different receptors like H1, H2, H3, H4. So it blocks the action at receptor level. Another one is competes with histamine for binding. Third one is displaces histamine from the receptors. So it is based on its sedative effect and its potency. It is classified as one is H1 receptor antagonist. First one is H1 receptor antagonist. In that, sedative, which is also called first generation antihistamines. It has got a sedative effects. It's highly lipid soluble and easily enters into the CNS. It is highly lipid soluble, thereby it can enter into CNS, thereby it gives a sedative effect. In that, potent and marked sedatives like promethazine, widely used diphenhydramine and dimenhydrinate. Other one is potent but moderately sedative like chlorcyclizine, chlorpheniramine, tetrahydroxycarbolin. Then there are less potent and less sedative like pheniramine and mepiramine. The other one is non-sedative, which is also called second generation antihistamines, which is less lipid soluble compared to the first generation. Therefore, that cannot enter the CNS. There will be less sedative effects. Cetirizine, fexofenadine, ibastine, loratadine, ketotifen and azelastine. But in that cetirizine, it can cause some kind of sedative effects. The other fexofenadine, ibastine, loratadine all are second generation, which has a very less, mainly there is no sedative effects. So mechanism of action, H1 antihistamines antagonize the effect of histamine by competitively blocking the H1 receptor, which is called competitive antagonism. So the antihistamines, H1 antihistamines, it antagonize the histamine actions by blocking H1 receptors. Then first generation H1 blockers, they are also called conventional antihistamines. Pharmacological actions are antagonism of histamine will lead to block histamine-induced bronchoconstriction. When histamine is released, there will be bronchoconstriction. this H1 blockers, it will block the action of histamine, thereby there will be relaxation in the bronchioles. Then contraction of intestine and smooth muscle and triple response will be diminished. And it's also used as an anti-allergic action. Most of the manifestation of immediate hypersensitivity type 1 reactions are suppressed. So the H1 blockers are used mainly for in anti-allergic, as an anti-allergic agents. On CNS, it produces variable degrees of CNS depression, sedation and drowsiness, because it can cross blood-brain barrier, so it can give CNS effects like depression, sedation and drowsiness. At toxic doses, excitement and convulsion are seen, as most of these drugs are lipophilic, easily cross blood-brain barrier and acts on CNS. So its anticholinergic actions like dryness of mouth, blurring of vision, constipation, urinary retention, because when the histamine is released, there will be a severe increase in the secretion, but these antihistamines block the acid secretion and other secretions in the mouth. There will be dryness of mouth can be seen. At higher doses, acts as a local anesthetic. They block sodium ion channels in excitable tissues like phenyramine, promethazine, diphenhydramine. Second one is second generation H1 blockers. Advantages over classical antihistamines. So here the first generation has got its sedative effect, second generation has no sedative effects. That's why here higher H1 selectivity, no anticholinergic side effects can be seen, do not impair psychomotor performances. So whenever the patient is taken these antihistamines, it is advised not to drive, not to engage in activity of using any motor or any kind of machines. So here second generation do not impair any kind of psychomotor performances. Absence of CNS depressant property, because they poorly cross blood-brain barriers. Additional anticholinergic mechanism, apart from histamine blockade, some also inhibit late phase allergic reaction by acting on leukotrienes or by antiplatelet activating factors effect. Some of them are long acting. So here we can see the examples. First generation H1 blockers, one is highly sedative, diphenhydramine and promethazine, which is also used as a cough suppressants. The doses are used 25 to 50 mg per day. Then moderately sedative like phenyramine, chlorheptadine, cinnarizine, mild sedative like chlorpheniramine and clemastine. Second generation drugs are like fexofenadine, which comes in 120 mg or 180 mg orally per day, and loratadine, cetirizine, levocetirizine, azilastine. These are all commonly used anti-allergic drugs. So therapeutic uses, this antihistamine is used in different therapeutic conditions like allergic diseases, oral antihistamines for allergic rhinitis and urticaria, because histamine is a principal mediator released by the mast cells. There will be severe allergic reaction when the histamine is released by the mast cells. So this during the allergic reaction, these antihistamines are used, which will block the allergic reactions. Then ophthalmic antihistamines such as azilastine, olopatadine, ketotifen are useful for the treatment of allergic conjunctivitis, and also it is used for a common cold for relief by anticholinergic effect. There will be sedative effects can be seen. In motion sickness, some people have the vomiting tendency during travel. So it is advised to give these antihistamines 30 to 60 minutes before the journey, which has got anticholinergic actions. Thereby it suppresses the vomiting sensation. Then also it is used in the pre-anesthetic medication like promethazine as a sedative and anticholinergic effect, because when there is in some patients when anesthetics given, there will be tendency of vomiting and increase secretion. So to prevent that one, these antihistamines are used. Then treatment of vertigo and Parkinsonism. Promethazine and diphenhydramine are used for treatment of drug-induced Parkinsonism. And also it is used as a cough suppressant. Antihistamines like chlorpheniramine, diphenhydramine and promethazine used as a cough suppressant. Then as a sedative and hypnotics, which can induce sleep, especially in children. Adverse effects are sedation, drowsiness, lack of concentration, headache, fatigue, nausea, vomiting, loss of appetite and epigastric discomfort, dry mouth and blurring of vision can be seen in the antihistamine administration. Then H2 blockers, they are gastroselective antihistamines. So it's mainly present in the GIT. So the H2 blockers like cimetidine, ranitidine, nizatidine, famotidine, which blocks the action of H2 receptor, blocks H2 receptor on parietal cells in the stomach line. There will be parietal cells in that the H2 receptors are there. When it is blocked, there will be decreased secretion. Therapeutic uses of H2 blockers are treatment of peptic ulcer, duodenal and gastric ulcer, gastroesophageal reflux disease GERD, symptomatic relief of heartburn, then prophylaxis of stress ulcers, and also pre-anesthetic medication like famotidine. Then third one is H3 blockers. They modulate the histaminergic neurotransmission in brain. They have application in obesity, sleep disorders, neuropsychiatric disorders and cognitive functions. Example, thioperamide and clobenprofit. At the end of this session, let's see the summary. The histamine is an important amine autocoid involved in inflammation, allergy and gastric acid secretion. So synthesized from histidine, stored in mast cell and basophils and released during allergic reactions. Acts through different types of receptor H1, H2, H3 and H4 receptors, each with the distinct location and functions. Histamine analogues like beta-histine and betazole have diagnostic and therapeutic uses. Then antihistamines are classified into H1 blocker, H2 blocker. H1 blocker, this first and second generation antihistamines, which has a sedative and non-sedative effects. Then H2 blocker, which is mainly used to reduce gastric acid, example ranitidine, famotidine, etc. H1 antihistamines are useful in allergy, cold, motion sickness, insomnia and cough. Side effects include sedation, dry mouth and GI discomfort. So these are the references. So here we end the lecture series, this topic. So keep learning. Thank you.